If you've used Q-tips your whole life and never had a problem, you're not alone. Many people can use Q-tips for years without any issues. But if you've ever cleaned your ears and felt more blocked afterwards, or if you've ever just wondered how to clean your ears without using Q-tips, this video is for you. I'm Dr. Stapleton, audiologist and founder of Better Hearing Rehabilitation Center in Durham, North Carolina. One common reason people end up in my office actually starts in their bathroom mirror. Today I'll show you 4 safe ways to manage earwax at home without Q-tips, why Q-tips can sometimes become a problem, and why sometimes doing nothing at all is actually the best option of all. Section 1, the truth about Q-tips. Here's the part most people don't hear. Most people can actually use Q-tips their entire lives and never have a problem. So if you're thinking, I've done this for years and my hearing is fine, you're probably right. Why audiologists don't recommend them. The issue is that a small percentage of people using Q-tips end up pushing wax deeper, causing blockages, infections, or even damaging the ear canal or eardrum. Those are the people who come in saying, I was just cleaning my ears and now I can't hear. Because we can't predict who that will happen to, audiologists aren't allowed to recommend Q-tips anymore, even though many people never have an issue. Section 2. Why Q-tips can sometimes backfire. The ear canal isn't straight, it curves. And another major issue is that you can't actually see into your own ear. So when something goes inside the canal, you're essentially cleaning blind. That makes it very easy to push wax in rather than out, especially around the curve of the ear canal. I often see patients who have unknowingly created a wall of wax deep in the ear canal. They had no idea it was there, but it was blocking sound and affecting how well they could hear. The good news is, once it's identified, this is usually very straightforward to treat. That's why ears can feel more blocked right after cleaning. And the deeper wax gets packed, the harder it is to remove safely at home. Section 3, what earwax is supposed to do. Earwax isn't dirt, it's protective. It traps debris, protects the skin, and naturally moves outward over time. The goal isn't to remove all earwax, it's to avoid creating an impaction. Section 4, safe ways to clean your ears at home. Option 1, do nothing. For many people, the safest option is nothing. If your ears don't feel blocked, itchy, or full, they're likely cleaning themselves and are not overproducing wax. Option 2, clean only the outside. You can gently clean the outer ear, the part you can see, with a washcloth. Nothing goes into the canal. Option 3, cleaning your ears in the shower for some people. Another option for some people is letting warm water rinse the ear in the shower. No tools, just water. This can help loosen wax near the opening so it can move out naturally. However, this won't be effective if you already have impacted wax. In that case, the impaction needs to be removed first. Once the ear is clear, this method can be used regularly to help prevent future buildup and reduce the chance of another impaction. But this is not a good option for everyone. Who should avoid the shower method? If you're prone to ear infections or swimmer's ear, moisture can make things worse. And if you have a known or suspected perforated eardrum, water in the ear can be harmful. If water tends to get trapped in your ears, this method probably isn't right for you. Option 4. Ear softening drops. Over-the-counter ear drops can help soften wax so your ear can move it naturally. But avoid these if you have pain, drainage, or a history of eardrum problems. And in some people, frequent use of eardrops can actually trigger the ear to produce more wax over time. If you notice you're needing drops more and more often, that's usually a sign to stop and have your ears checked. Many people also ask me about hydrogen peroxide. Hydrogen peroxide can help break up wax by bubbling and loosening it, but that bubbling could also irritate the ear canal in some people. For some, occasional use doesn't cause problems, but for others, it can dry out or inflame the ear canal and actually make wax issues worse over time. That's why it's not something I recommend using regularly or as a routine ear cleaning method, and it should always be avoided if you have pain, drainage, frequent ear infections, or a history of a perforated eardrum. In general, over-the-counter earwax softening drops are formulated to be more gentle and more predictable. That doesn't mean they're right for everyone, but when used appropriately, they tend to be better tolerated than things like hydrogen peroxide. Section 5. What to avoid completely. Avoid ear candles. Unfortunately, they don't work and can cause burns. Avoid metal tools or ear picks. They can easily scratch or injure the delicate skin of the ear canal, which increases the risk of infection and inflammation, and they often push wax deeper instead of removing it. And avoid aggressive flushing. Strong water pressure can force wax farther into the ear canal, cause pain or dizziness, and in some cases damage the eardrum, especially if you don't know what the ear looks like inside. Section 6. When to stop and see an audiologist. If you notice sudden hearing loss, pain, ringing, dizziness, or persistent fullness, stop trying to manage it at home. That's usually impacted wax, not dirty ears, and professional removal is safer and more effective. Most ears don't actually need much help. The skin of the ear canal is constantly growing outward, which is part of the ear's natural self-cleaning process. The ears often just need us to stop interfering. But if you do feel like your ears need a little more help, try one of the safe methods we talked about today. And if you ever feel like the problem is beyond what you can manage at home, always reach out to your local audiologist or ENT. If this video was helpful, watch my upcoming video on why your ears can feel full even when there's no wax at all, because that one surprises a lot of people.